My name is Dr. Roberto Mitsui, one of the endocrinologists at King's Daughters. November is Diabetes Awareness Month, so I would like to give a couple of tips regarding that. There are different types of diabetes. There are diabetes type 1, when there is no insulin production, and diabetes type 2 is it happens mainly in obese people when there is something called insulin resistance. So the fat tissue makes it more resistant to insulin. Signs and symptoms of diabetes: they might start feeling fatigue, feeling tired, not feeling well. They may have increased thirst, start drinking more water. They also may start having blurry vision and start losing weight. So if any of the patient has those symptoms, my recommendation will be to go to the primary care physician. One of the labs that is commonly done is the hemoglobin A1C that can tell if a person is diabetic or not. Risk factor for diabetes is is family history of diabetes. Usually having a family with diabetes, some people are more predisposed to have diabetes. And second is the obesity. As I said earlier, in type 2 diabetes, the fat tissue makes it more resistant to insulin, so having obesity is one of the major risks to have diabetes, especially type 2. Prevention of diabetes, I'll say doing regular exercise. Ideally, if a person can do 15 to 30 minutes of moderate intensity exercise 5 times a week, that'd be good. We usually recommend our diabetic patient to usually have a plate. Half of the plate has to be a non-starchy vegetable, a quarter has to be a protein, and the other quarter has to be the carbohydrates. First of all, for the patients that are recently diagnosed with diabetes, if it's considered pre-diabetes, first we recommend the lifestyle modifications, so the diet that I mentioned earlier and exercise. If that is not possible, we usually start with metformin, so it's a medication that makes our body more sensitive to insulin. Then gradually we start with different medications. Have a regular checkup with the primary care physicians. I think that's one of the key things to do, because recognition of diabetes is very important, and that can be done by a yearly lab that is done by the primary care physician. We also have diabetes educators that can help with the management of diabetes. Sometimes we don't have enough time during the visit to discuss all of the things about diet, treatment of low blood sugars, so definitely they're helping us to manage the diabetes. Now that the technology has advanced quite significantly, we have devices that is called continuous glucose monitoring. So those are devices that are placed either in the belly, on the back of the arms, that is checking the blood sugar every 5 minutes, and the latest one is checking every minute. So definitely those are the tools that are very helpful for the management of the diabetes. And yep, I think if the patient is interested, definitely has to discuss with the family doctor or the endocrinologist to see if they qualify for those devices.